in toddlers, some of the symptoms to look for. It's part of the gluten-free family series I'm working on. And children who have heightened risk for celiac disease, according to the Children's Digestive Health and Nutrition Foundations, are as follows. Children with dermatitis herpetiformis, I typically say that wrong, type 1 diabetes, IgA deficiency, Down syndrome, Turner syndrome, Williams syndrome, thyroid disease, or children with first-degree relatives with celiac disease. And so if your child has any of those, they have a higher risk and chance of developing celiac disease. Also, children, or I guess I should say toddlers, symptoms in toddlers with celiac disease are often that they are very picky eaters, they're whiny, they're clingy, they're tired, they are cranky, they have a lot of yucky diapers, like very yucky. But this is not that different from most toddlers' behaviors. So you need to really see if these are like very severe behaviors you're dealing with, or if this is just typical of your, child during certain kind of situations. It says some children with celiac have severe symptoms including failure to thrive, vomiting, diarrhea, and muscle wasting with a bloated abdomen, while others only have subtle symptoms such as clinginess, tiredness, and irritability. Most have some symptoms somewhere in between that. But things to look for: abdominal bloating and pain. Now, people think this can occur at ingestion, but remember that this is not an allergy, it's an autoimmune disease, so the response is slower to actually show symptoms, to actually see this abdominal pain or bloating. Before I get any pain, I will show keratosis pilaris on my arms, which are kind of little white bumps, and I get pink cheeks typically. Next, you'll see chronic diarrhea or constipation. Typically in adults, you'll tend to see one or the other, but in toddlers, you'll typically see both, bouts of each. Then you'll deal with the fatty stool. How exciting. This is due to the fact that the fat in the body of your toddler is not being absorbed correctly, so it's excreted through what doctors have deemed a fatty stool. It's often foul-smelling, which I'm sure you're saying all my child's diapers are foul-smelling, but it's lighter in color in some areas. That's really gross, but people in the celiac community, I guess we talk about poop. And weight loss, which is also known as failure to thrive. I spoke earlier about that. But most people associate this weight loss with their child being a picky eater, but it's more likely than not that they're not able to absorb and they're malnourished. So a lot of times you'll see really skinny children with bellies on them. And typically they're under their height, they're a little bit shorter. And malnourishment and chronic diarrhea can cause weight loss in this critical growth period for toddlers. And if celiac disease goes untreated, weight loss and nutrient deficiencies can lead to delayed development, increased susceptibility for viruses, infections and other diseases, reduced bone density, and increased chance of delayed puberty later in life. So if you really suspect that your child could have celiac, it's very important to get them tested. Remember, do not take them off gluten prior to having them tested. It's not something to see if they feel better. You need to have your doctor check first, because you'll only test positive if you have inflamed villi. And also, if you have a family history of celiac disease, make sure your doctor does a genetic test to see if your child is going to be positive for celiac disease and carries the alleles. So anyway, thank you so much for watching. As always, it's from Have Not to Have in gluten-free dining and in life for that matter, and I hope you're doing well.